Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Good morning. Thank you for joining us. My name is Ngozi Ediosage. I'm a paediatrician. I work in Manchester. I'm also the medical lead for the Caribbean African Health Network. So welcome to another interesting session about health matters for Black people. Today we have Dr. Ambrose Nwachukwu, who was here last week. He's a consultant psychiatrist. He's also an honorary senior lecturer at the University of Sheffield. Today, continuing our theme for April, where we're looking at mental health, we're looking at the problem of post-traumatic stress disorder, widely known as PTSD. Let me get my acronyms right. And this is very, very relevant for today because we know that the COVID has left lots of us with anxiety, and this is really stressful for a lot of people. So I think the instance of PTSD has gone up. And so we need to know how to manage this in ourselves, recognize it in others, and see what sorts of things we can do to help the situation or refer on to the relevant services. So Dr. Ambrose Nwachukwu this morning is going to tell us all about PTSD, how we can help ourselves. It's another of our sessions to help you empower yourself and to take control of your own health. So without further ado, I'll introduce Dr. Ambrose to take over the session. Thank you for coming.
Hello, everyone, and welcome to today's session. Once again, I'm here to talk to you about post-traumatic stress disorder. As you can see, I'm dressed in my African regalia. We're going for someone's 58th birthday today. And we're going to showcase our Africanness. Ngozi was very right with that introduction, especially during this period of COVID-19 pandemic and all the environmental public health measures that were taken to deal with the virus, especially at the initial periods where there was total lockdown. There were isolations when people were told to isolate, quarantine, and all those sort of things. People were so traumatized, afraid, anxious, and it looks like even within the medical circle where we are struggling to understand the virus, make sense of what was happening, know the best way to deal with it. So it was not only the populace that was traumatized by the effect of the COVID-19 pandemic, doctors as well, nurses and other healthcare staff, ambulance crew, A lot of doctors develop moral injuries as a result of that. So today, PTSD is very relevant and very topical. How many of you have heard about PTSD before? If you have, it will be helpful for you to say yes in that chat box as we go ahead. Okay. This will help me to know how to pitch the presentation. Yeah, it looks like people are saying yes. That's very good. So what is PTSD? A lot of psychologists, psychiatrists, people that have a special interest in mental health have tried to define what PTSD is. Generally, it is thought to be a psychiatric disorder that may occur in people who have experienced or witnessed all sorts of traumatic events. So by using the word may, what that does imply is that not everyone who is exposed to trauma goes on to develop post-traumatic stress disorder. There's a lot of anxiety around it. It's a form of anxiety disorder as well. So, and many times people who suffer with these disorders do present to their GPs. We are going to look at what could lead to people developing post-traumatic stress disorder. The key factor, the main thing is exposure to traumatic events. Often these events are very life-threatening. They are very catastrophic or life-threatening events. It could be accident where someone is involved or where someone has witnessed it. It could be natural disasters, sexual violence like rape. It could be traumatic death, political imprisonment or torture, physical abuse, childhood abuse, even the coronavirus pandemic as well, as we mentioned earlier. So exposure is key to developing post-traumatic stress disorder. It could be a direct exposure, as we said, where someone is involved directly with the trauma, or it could be indirect, where someone has witnessed another person go through that traumatic experience. Or even when you listen to loved ones or close family and relatives talk about the trauma they have gone through. So someone could develop PTSD as a result of that. Also, it could be due to repeated trauma, where people undergo trauma over and over again. So some of the risk factors then can be previous traumatic experience, like we mentioned earlier on. History of abuse is a strong one. Abuse can come in various forms: sexual, physical, emotional abuse, neglect, family history of having someone that have suffered from PTSD before, or mood disorders such as depression, because there has been some association with hereditary genetic link that it could run in families. History of substance abuse, where people are using substances or drinking. And in some people who, by the nature of their being, do not cope very well with stressful life situations. So for people with very poor coping strategies or skills, it could happen, or where there is a lack of social support or ongoing stress. So what are the symptoms of PTSD? What are the things that we see in people who are suffering from PTSD? When they do come to their GPs or to psychiatrists, or psychologists, mental health nurses, they do report a lot about recurrent memories about a kind of a traumatic events that they passed through, and they also do tell us about reliving reliving the event during the day in the form of daydreams, flashbacks. At night, they suffer with nightmares. Most of all these experiences are related to the trauma. So also some of them go on to tell you that they, feel very distressed since after the traumatic incident. As a result of that, they might start avoiding, and avoidance can be in different forms. It might be avoiding thinking about the event, avoiding remembering people who were involved with the incident, avoiding remembering the place the incident took place, avoiding going to the place or conversations that remind them about that, or activities even that reminded them of that. For instance, if it is people that were driving and when it occurred, they might stop driving completely. They suffer a lot with negative thoughts. They blame themselves for the incident, guilt feelings, fear, like we mentioned earlier, fear of horror, anger, shame. They begin to become withdrawn, lose interest in pleasurable activities. So kind of they become reclusive and they struggle to feel or remain positive as well. So you could see that there's a lot of difficulties people with PTSD go through. At times when they talk, they come across as being quite irritable or aggressive, and they might begin to do things that are self-destructive, like self-harm, as we mentioned last week. One characteristic feature is that these people become very hypervigilant, watching out for danger. Any little thing startles them, and they struggle to concentrate or focus on tasks. And another key factor is that they struggle to sleep. Their sleep is broken, especially with these negative thoughts and nightmares. So why does PTSD occur? A lot of psychologists and psychiatrists have tried to explain, why PTSD occurs. They have tried to make sense of what goes on in our bodies, in our brain, when people are exposed to trauma. So they feel that, normally, usually the nature of the trauma, is very important. It is usually catastrophic trauma. So people tend to develop strategies to deal with that trauma, because some physical, sometimes mental trauma is very difficult for people to deal with. As a result of that, the body has some mechanisms to deal with it, developing strategies to cope with it, which are not very helpful. It might be that they become more reclusive, it might be that they avoid those kind of things. And this feeds into that, symptoms as well, the PTSD, negative appraisal of the situation. When they think about it, they're always thinking about it in the negative perspective. So emotional regulation is affected, and this abnormal fear. Normally when people are faced with difficult or challenging situations, very frightening ones, the body tends to develop some mechanisms in place to deal with it, for you to either confront that anxiety-provoking or that danger, or for you to, gather the courage to run away from it. So there are some physiological processes that go on in your body. Some chemicals are released to help your muscles to tighten up and to help you to run away or to fight that danger. So all these things make people to become more hypervigilant, to become more anxious and worried. So like I mentioned, PTSD can lead to psychological processes going on and also some physical processes going on. So some psychologists and psychiatrists have tried to look at it from those two angles. Like we mentioned before, in terms of psychological, it's all about worries, fears, anxiety, panics, due to the memories of the event that are not well processed, that now feeds back to the PTSD symptoms and vice versa, forming a vicious cycle. Those unhelpful beliefs that we spoke about earlier, and avoidance and safety strategies. So the physical aspect is some neurochemicals, chemicals in the brain like adrenaline that are released. This adrenaline helps in the fight and flight mechanism that I discussed earlier, which the body naturally uses to deal with anxiety-provoking situations. And people it's thought to be a kind of PTSD is thought to affect the area of the brain, the hippocampus, hypothalamus, all those areas you see there, to amygdala to cause these reactions. All these things are theories. Nobody and no single theory or explanation can fully explain all the symptoms that people with PTSD do present with. How common is PTSD? Is it really a problem? Like when we started, we did mention that the coronavirus, COVID-19 pandemic has even worsened the prevalence of PTSD, although not many studies since the virus has come out in relation to that. It is generally thought that about half of the people will experience a trauma at some point in their life, and around 20% of those people may go on to develop PTSD. So there's a huge 80% of people who pass through trauma that do not go on to develop PTSD. Why is that? And then when you look at it on the other hand, 20% of people is a huge amount of people. So 1 in 10 people at some point in their lives develop PTSD. And then if you look at women compared to men as well, there's some huge difference. 10% of women compared to men develop PTSD. A lot of studies have been done to kind of find out how certain traumatic life situations lead to development of PTSD, and the percentage of people who tend to develop PTSD as a result. And as you can see in this diagram, rape occupies the highest on the list. Almost half of people who are raped go on to develop post-traumatic stress disorder, whereas natural disaster is 4. You could see things like sexual assault, about 24%, which is huge. Police officers, you see, so people, some professions can lead to people developing PTSD, military personnel, people who witness that. So it's a huge problem. Paramedics, domestic violence. There has been research that during the COVID-19 pandemic, there has been a steady increase in reported instances of domestic violence, substance misuse, gambling, things like that. So another important factor in PTSD is adverse experiences that may have occurred, during childhood. There's a strong evidence that people that experiences negative events as they are growing up can develop PTSD, or even changes in their personality that lead them to present with personality disorders in later life. So as you can see here, it's not very clear. 7 in 10 people, children, reported one or more adverse childhood experiences by the age of 8 years, while about 1 in 10 of them reported about 3 or more. Also, in terms of mother's age is thought to be a huge factor as well. When women have babies when they're under 20 versus when they are 25 years and above. You could see some of those statistics there as well. Mothers with a higher degree qualification who are aged with children aged 10 months. So about 17% of those mothers who are under 20, their children develop reported adverse childhood experiences, whereas 80% in mothers 25 years and above did report that. So these are some of the evidence I could find online. So childhood trauma, you could see, is an important risk factor. And there has been explanation that this might be related to the time the child's brain is still developing, and can lead to abnormal attachment or attachment disorders. And it can have impact in their personalities, developing somatic symptoms, physical symptoms. It can affect their emotions, how their emotions are being regulated. And it could lead later to dissociation, dissociative disorders, whereby people don't feel real, or the world around them don't feel real, as a result of the body trying to cope with those trauma. So it could come in the form of memory loss, come in the form of lack of awareness of self, those deja vu and others. Even sometimes non-epileptic attack disorders can arise as a result of that. It could also lead to behavioral, kind of poor behavioral control. We do see a lot of children in psychiatry that presents with challenging behavior, sometimes conduct disorders, ADHD or those sorts. Cognitively can affect the child's, understanding, learning, intelligence, self-concept and view of self, and social ability of the child to develop along the pathway of life very helpful, positive interpersonal relationships. So you could see a whole lot of impact of trauma in children. Last week we talked about children that self-harm. It could lead to, all these maladaptive behaviors, all these unhelpful behaviors to cope, like self-harm as well. Is this a problem in Black communities? Is PTSD a problem? There have been a lot of studies, most of them in the United States, that looked at, the prevalence of PTSD within the Black and ethnic minority groups. And as you can see on the slide, PTSD and depression are common outcomes of traumatic exposure. And there has been a lot of kind of feelings that they are understudied within the Black community. And Blacks of all age groups are more likely to be victims of serious violence than non-Hispanics whites in the US. You can, if you watch the news, you would see a lot of, kind of discrimination towards Black people in the US, even amongst the police personnel, shooting and killing Black people. Black Lives Matters movement came as a result of that. So one study reported that over 25% of Black youths exposed to violence met the criteria for diagnosis of post-traumatic stress disorder. So it's a huge, huge problem within the Black community. And 20% of our communities are more likely to report having serious psychological distress than other minority groups. 30% of inner city kids suffer from PTSD as well. So this is from the Center for Disease Control, CDC, 2014 study. A lot of researchers have looked at the effect of stigma as well in developing PTSD, and they came up with the findings that as people undergo or as people are exposed to repeated trauma, they tend to be more likely to develop PTSD. As you can see, people that are exposed to trauma, as it moves from 10 to 60, the chances of developing PTSD moved between 0.0 towards 1. And if you look at the control group of non-stigma group, which is the one that is lighter, you could see that it is lower than the dark one. And that shows you that stigma as an entity can affect, can predispose or is associated with increased risk of developing PTSD. And within the Black and ethnic minority groups, we are more, or we feel more stigmatized, discriminated upon, racially abused. So this is a very important topic within our communities. That led to a lot of Black psychologists and writers to look at, how best to describe PTSD in a way that it resonates more with them, especially with the horrific or horrible history of slavery. So they coined a terminology, post-traumatic slave syndrome. Eugene Ellis is one of the psychologists that he does some kind of YouTube videos. So there's a link there where you could watch these videos. He explored things like white privilege and tried to unmask it, sometimes unconscious bias towards the Black population, systemic racism to occur. So he further recognizing the legacies of slavery in contemporary psychotherapy is quite important, especially within the Black communities. They came up with terms like post-slave syndrome and intergenerational trauma. It's like what happened to most Jamaicans that came here several years ago, and is it a Windrush issue in the UK? And at some point, the UK wants to deport these people. Some of them were born here. Some of them don't know, have kind of integrated within UK society, and they wanted to send them back. And it caused a huge, huge issue in the UK. So Black presence, white fragility, and the nature of work for therapeutic practitioners. So Eugene Ellis talks a lot about post-traumatic slave syndrome. Another author is Dr. Joy DeGroy, and who looked at it as well. And I don't know whether any of you have watched the movie Roots. If you have watched Roots, can you indicate in the chat box, please. It's a very good one for you to watch. It's about the evils of slavery, how people were forcefully abducted from their home environment, tied and put in the ship, some of them thrown in the sea, whales ate them. And it's so horrific. The first time I watched it, I couldn't deal with the after effect of that. I passed through several emotional reactions of anger, guilt, frustration that even in this, no reparation has been paid. People are still maltreated. Neocolonialism seems to be another form of slavery ongoing in our societies. So these things do happen. So he described post-traumatic slave syndrome as a condition that exists where a population have experienced a multi-generational trauma that results from centuries of slavery and continues to happen in our communities where they continue to experience oppression and institutional racism. Is there a link between PTSD and career? We've mentioned a few of them earlier on. Of course, there is a huge one indeed. People, emergency workers, there's a lot of research. I'm not going into all those that shows that emergency workers are more prone to developing PTSD. Also social workers, soldiers, military personnel, intensive care practitioners, doctors and nurses, and people living in a war zone. There's been huge research evidence to show that they do. And during this COVID-19 pandemic, like I mentioned earlier, moral injury, there's been some evidence to show that moral injury is happening in doctors that work in A&E, intensive care unit, doctor, nurses, and other healthcare workers. I was working in Sheffield liaison psychiatry, A&E, during the whole of the COVID-19 pandemic, and it was very horrific what I experienced. And we were very thankful to the psychologists who were regularly coming to offer us help during that period. So when does PTSD develop? After someone is exposed to a traumatic event? They could start having symptoms immediately after, or weeks or months afterwards. And this occurs usually within the first 6 months of the event. Some people do report having symptoms after 6 months, but that is not as common. The diagnostic criteria stipulates that you cannot diagnose someone with PTSD in the first month of having a traumatic event. We tend to call it acute stress disorder. So complex PTSD is another terminology that has been used to describe people who experience repeated traumatic events throughout their life, where they have little or no chance of escape, particularly when these events are or exposures are quite prolonged or repetitive. This is the WHO definition of complex PTSD, and is a terminology that be used in the new classification that we use in psychiatry called the International Classification of Diseases, the new one coming out in the next couple of years, ICD-11. So some people have tried to describe complex PTSD as a different entity, but it's more, in a layman's term, it's more like a more severe form of PTSD. And it's common with victims of chronic sexual, psychological, or physical abuse, partner violence, victims of kidnapping or hostage, and indentured servants, victims of slavery, like we mentioned, human trafficking, people who have been neglected for so long, torture, slavery, genocide campaigns, living in a war zone, prolonged domestic violence, like we mentioned, repeated childhood, sexual and physical abuse. Why is it that some people do not develop PTSD despite being exposed to trauma? From the earlier slides, we showed only about 20% do develop PTSD, whereas 80 don't. People have begun to question, why is that? So some people have said maybe some people, heal from their trauma quite quickly, as a result of connecting with their communities. Maybe because as a result of being in stable relationships, so social factors, access to social care, and a low stress lifestyle. Even some people have thought about, the environment, the healing environment as well. If you have a very well supported family, it might be protective. All around the world, we do see police incidents, murder, even in immigration and detention facilities. I've had experience of treating people who have run away from abuse and wars to the UK. I have seen a few of them. One of them came from Sudan, a 40-year-old woman who arrived in the UK in the year 2010 to seek asylum and was detained in the immigration facility. She was raped in Sudan, repeatedly raped by soldiers during the war there. And while in detention in the UK, she witnessed a murder. And since then, she has been unable to sleep. When I saw her, she complained of poor sleep and getting flashbacks and nightmares, related to the various traumatic life experiences she has passed through. So how can we help this woman? Do you think such a woman can be helped? I want some information on the chat box, please. Or have you, heard about something like this, or someone with similar experience before? If you have, can you put something in the chat box? Just to make sure that you are hearing me. Are you there?
Yes, we can hear you. We can hear you.
Excellent. Excellent.
Everybody can hear.
Yeah, it got a little bit cold. I want to make sure they're not sleeping off.
No, I think the chat box is, whilst it's monitored, there are people who are watching on.
Okay, I can hear you. That's fine.
That can't contribute to the chat box, but they're listening. Thank you.
Yeah, excellent. Okay, people are writing in the chat box, which is quite helpful. So if somebody said, I hope so, that this woman can be helped. She needs counseling with someone who is highly experienced in trauma. Good. So how do we diagnose PTSD? I think a very good and comprehensive history is very important. History of trauma, abuse, trauma in any form or shape, is very important, and you explore that very well. And then do your mental state examination to find out if there is comorbid, if there is any other psychiatric problems like depression, other anxiety disorders, panic attacks, agoraphobia. Maybe they're not willing to go out again or be in a crowd as a result of what they have passed through. So you need to explore all that. Do they have family support? What is their support network? How do they cope? Do they use drugs and alcohol? Do they self-harm? Have they become so reclusive? Are they depressed? All these things are very important while trying to formulate or diagnose PTSD. So for this woman, in question, I wanted to keep thinking about her. It's quite awful, isn't it? So how can we help this woman? There are two different forms of help that we can offer this woman. It can be psychological and it can be medical. In fact, NICE guidelines, which is the National Institute of Clinical Excellence guidelines that we use, do recommend that we, prioritize psychological help first, and there are various forms of psychological therapies that have been, proposed. In the UK, there are two main forms that they recommend, which is mainly CBT, the type that they call trauma-focused CBT, which explores how the way they think about the trauma affects the way they feel about it and the way they behave subsequently. And then another one is, the psychological treatment has to start with acceptance, learning to accept that though you can change what has happened, you can think differently about the event and the world around you, and when you remember the event, what happened, so trying to, work towards not being overwhelmed or distressed by the memory of the event. Another one is trying to, put the experiences into words. Talking therapy, talking to it, talking about it with somebody in a kind of safe environment is very helpful. And feeling safe, helping you to feel more in control of your feelings, these are what the psychologists will work towards, for people who experience PTSD. And that is the trauma-focused CBT, like we mentioned before, trying to deal with the way your thoughts about the event affects your emotions and your behavior, and continues in that vicious cycle. So CBT tries to break this vicious cycle, so that you can think differently, what they call cognitive restructuring, trying to change the way you think, the way you behave, and the way you feel about your trauma. Another very important one that is offered within the NHS is high movement desensitization and reprocessing. It's called EMDR. It's it appears like magic, because someone will sit with you, and while you bring to the fore the trauma you passed through, he or she will be moving the fingers and you'll be following it. There's a lot of theories that have postulated that it helps to delete the trauma or make it less distressful for you. So as you can see there, about 67% of subjects treated with EMDR for 5 sections had no signs of PTSD following that. And 75% of adult trauma victims exhibited no symptoms of PTSD after 8 sessions. You can imagine how, beneficial it is. So it does work. Psychological treatment does work for PTSD. For people who did not respond very well to psychological treatment, they can be offered pharmacological, that is medication. And in the UK here, we use the one we call SSRI, antidepressants. There's quite a few of them that we use to treat it. You as a person, how can you help or manage someone with PTSD? If you are struggling with symptoms of PTSD, how can you help yourself? By keeping to your usual routine, talking to someone you trust can be quite reassuring and helpful. Trying to relax, relaxation exercises, mindfulness, yoga, going back to work or school to distract yourself from all these unhelpful thoughts, eating healthy and exercise to kind of improve both physical and mental health, spending time with others, especially loved ones, family and friends, being positive, expecting to get better, is the way to follow it up. And ability to go back to where the traumatic event happened is a positive factor if you can. It helps to reassure you. But there are things you should avoid. Being self-critical can be quite debilitating and lead to deterioration in your mental health. And if you keep your feelings to yourself as well, it could lead to people being depressed, more anxious, and even suicidal thoughts. Expecting the trauma to go away, many of these people, like this woman, will come to you to say, doctor, I want these feelings and thoughts to go away now. So a magic wand to make it go away. Unfortunately, it doesn't go away like that. Staying away from people is not helpful, and using alcohol and drugs to cope can be quite unhelpful. Getting overtired as well. So proper sleep is very important, most especially when people that suffer from PTSD struggle with sleep. And if you know someone who has symptoms of PTSD, how can you help? Changes in behavior is quite important. Poor performance at work, lateness, taking sick leave, minor accidents. So these are some of the things that can happen. So if you ask the person about these experiences, how to support the person, there could be change. You could see the person, there's been some changes in her emotion. She's becoming more angry, irritable, or more withdrawn, becoming more afraid and having negative views about the future. These are some of the things you could see if we are in close contact with someone with PTSD. Unexpected physical symptoms like breathlessness, being jumpy, stomachache. These are some of the physical signs of anxiety. So talking with that person can be quite helpful, but do not talk over the person. Listen to them, allow them to share their views. Do not tell them you understand how they feel, because people can feel or have a different experience of trauma, even if you have passed through similar situations. Asking general questions that are perceived as non-judgmental can be helpful. So avoid telling them you know how they feel. Avoid telling them they are lucky, because they might be feeling guilty. They might be the driver when their family members died and they're feeling quite guilty of being alive. So don't minimize their experience or make an unhelpful suggestion for these people. There's lots of information for to access on PTSD. If you go on these websites, there are laws to support people who might be experiencing PTSD. And also there are charities that support people who have passed through some traumatic experiences, like PTSD UK. I've given you the websites. Combat Stress, especially for veterans, British Legion. Cruise Bereavement Care can be helpful. And Rep Crisis, they are very helpful for people who have experienced sexual violence. So, do we think we would have helped this woman if we offer her all we have discussed above, based on some of the evidence that we've highlighted? I would like to see what you think in the chat. If I see 2 or 3 people respond, I will move on. What do you think, based on the evidence we've shown, that psychology does help and some people can benefit from medication? Do you think we would have helped this woman? I think in addition to this woman wants asylum as well, isn't it? Looking at the social aspects of care can be quite helpful, providing her with accommodation, benefits, also, a kind of a job, volunteering can be quite helpful for this woman as well. It's not just psychology and medication. So the social aspects of care is important. And that is why in psychiatry, We'll use the biopsychosocial model, look at psychology, look at medication and the other social aspects of care. This is a beautiful poem by Ellen Preston. How am I supposed to feel when the nightmares and pain become it's supposed to be so real? What am I supposed to say when all my hope has gone away? Where do I go when life passes by and all I want to do is die? When do I get a choice and quiet the endless voice? Flashbacks, isolation, and hypervigilance around. Peace and calm can't be found. The grim reaper scares me not. I live in hell and fear him not. PTSD, I'm the walking dead, stuck with the memories inside my head. Thank you.
Thank you very much. Thank you for your presentation and sharing that. We do have a number of comments and questions in the chat, which I'm just going to try and share with you. So team, could you just highlight Dr. Ambrose's video as well, please? Thank you. So there's some questions on the interplay of religion and PTSD. So there's some questions and comments about the fact that sometimes can be difficult when people may go to their places of worship with symptoms of PTSD, but are accused of having, may be accused of having demons. I suppose this is a generalization because we know that there are many faith communities that are very supportive and will be able to point people in the right direction. But one of the comments is about needing clarity between our faith communities regarding the difference between the generational trauma that you've talked about and what people refer to as generational sin and curses.
Yeah, that's a very important question. And within the Black and ethnic minority groups, religion is a powerful factor. So powerful that anything that happens to them, be it good or bad, their first approach is to run to God or to the church or to their pastors or priests. So we cannot underestimate the impact of religion in our lives as Black and ethnic minority group. So I would always want to view religion from a positive perspective. And I agree with you, Ngozi, that in the UK, especially in Western societies now, most religious groups have like things like safeguarding groups. They have like safeguarding leads. They have like counselors that you could run to. And most of the priests, or the pastors, if you come to them and they think this is mental health related, they can signpost you to relevant agencies. It could be supporting you to ring your GPs, IAP to improve access to psychological therapies. The counselors within the church can even escalate things if necessary. So I don't think that a lot of people these days, when they go to their churches, they are thought to be demon-possessed, especially in Western societies. Having said that, I'm aware that in our African societies, back home in Africa, the practice still exists. Mental health is perceived as being demon-possessed. So once you report anything that is not physical, the first approach will be to cast out, to exorcise you in the church. So that is all I have to answer about that. I don't know whether anybody else have anything to say.
Okay. The other question that we've got is that I think you've presented some really florid cases of people who have been raped and people have undergone really detailed personal trauma. But I guess there'll be lots of people who are listening today who are sort of just like everybody else, who have been through this last pandemic. And there may be people who have areas of concern, because I know that one of the things that has happened is that people are much more reluctant to go out, even though they've said everybody can take their masks off. There is a level of concern that is very anxiety provoking for some people who have stayed at home for the past 2 years, and going out into society, into the shops and on public transport, they're really worried about it. What's the interplay? Are you seeing more people present to you for this prolonged low level, medium level trauma of anxiety of going out, and what can you do? Because I guess there's a level that you think, well, it's sort of acceptable, because I remember the first time I went out and there was nobody with a mask on. I'm still wearing masks in hospital. There's a bit of anxiety, especially when people cough next to you. But that's to be expected. But I think there are some people who have found it really difficult to go out in society, and how can that be helped?
Okay. Yeah, that's a very relevant question. And thank you for that, Ngozi. In the past, during the heart of the pandemic, I did a presentation, I think it was a countrywide presentation for doctors, nurses, and psychologists, whereby I talked to them about the psychology of pandemics, bringing about the historical perspectives and the current perspective and reality, how people respond during, kind of very difficult, life-threatening, global, what we call pandemic situations, the various ways people respond with rumors, with conspiracy theories and all those sorts. On one hand, low and medium level anxiety arise. People that suffer with low and medium level anxiety often go under the radar, and they form a majority of the people, and they don't access help. Even when they do go, they might be dismissed. But they struggle a lot over a long period of time as well. So they are a very important cohort that we do see in liaison psychiatry, as a result of this pandemic. Mind you, some people were asked to compulsorily isolate, quarantine. During that pandemic, don't come out. People will be bringing food and any of your needs. Don't come out because you've got significant physical health problem. If you come out, there's a chance that you might die. They kept writing them. The government was writing people, scaring them, and they were remaining indoors. So isolation, quarantine, all those public health environmental measures have not helped. So these type of people will need IAPT, improved access to psychological therapy, especially if they have become reclusive. They may have developed anxiety disorder. Majority of them, first and foremost, present to their GPs. And thankfully, IAPT can be accessed through primary care, through their GPs. Some of them that do present to secondary mental health services where we work, we assess them, do thorough assessment, and see whether they require medication. So some of them might require medication to motivate them, and there's something they call exposure therapy as well, where somebody, support worker, will be taking them in a kind of graded fashion to confront those anxiety-provoking situations that is making them reclusive and to isolate. And these are, there's a huge body of evidence to show that these are very helpful and they work. Thank you.
Okay. You talked about the intergenerational trauma. You referred to the Windrush, and there are questions that some of the viewers have asked from YouTube about how you can, what are the things that you can think that we can use to break these cycles of intergenerational trauma, either individually or collectively. We've had this whole month of a focus on mental health, and 3 weeks ago, we had a really interesting talk from somebody who specializes in psychosis. And one of the things that they talked about was the constant drip, drip, drip of lots of minor trauma contributing to that whole view of how you respond to trauma. So it starts from early childhood, being exposed to more trauma than your white peers, perhaps, maybe not having more names called you in the playground, to the teachers not treating you with the same level of respect and dignity. And this just continues your access to jobs, and all that contributes to your more negative outlook. And also your parents who have come to this country may have also experienced different levels of psychological trauma, and it just continues and continues. And we now have a higher level of psychosis in the Black community. So with all this, how do you break that intergenerational trauma? What advice do you have, and what studies are going on? And are these studies happening in the UK, or are they happening in America as well? I know that's quite a lot. I'm trying to combine the number of questions that have been asked on either directly or on the chat, in the chat. Thank you.
Yeah, thank you. That is a very important question as well. I will start with the first one about how can we address it either individually or as a community. There's a very strong factor within the Black and ethnic minority groups. That is what we call living in therapeutic communities. We live in a kind of community-driven societies, unlike the Caucasians that tend to be on their own. So things like religion is a strong factor within our communities. Cultural,
that's a positive factor, I presume.
Yeah, positive factor.
Yeah,
I'm talking about how do we deal with it, which is, I guess, will be positive things we can do to confront this. So that's what I'm talking about. Yeah, positive factors, religion is one, living in therapeutic communities, cohesions. I watch this, they call it the Brazilian carnival. It's like I watch it on online a lot. I've gone to London carnivals before. I watch reggae musics, you know, Bob Marley and all those stuffs. And then you see people express themselves, you know, their culture, dances, kind of a lot of cultural heritage helps as a group, as a community. Individually, if you have a very supportive home environment, your partner is quite supportive, your children are quite supportive, it can be helpful. Abstaining from drugs and alcohol and using a better way of coping can be quite helpful. On a wider perspective, racism is a huge one. I see it as a kind of diagnosis on its own psychological trauma. Somebody mentioned it in the chat box, discrimination and racism. Why is it that several centuries down the line, we are still talking about racism being very prevalent? Any job you go to in the UK, you'll be asked to do training on equality, racism, but you still find people who are racially discriminated. I attend Schwarz round, which is a kind of reflective practice rounds, where last week a nursing student and the nursing staff talked about the kind of racism and discrimination they experienced in the workplace. It was quite horrendous, and I've come down with depression and anxiety disorder. So has the Western world actually addressed the issue of slavery? Do you think if slavery happened in the West, there wouldn't be cause for reparation to bring about closure? Do you think?
Well,
so I'm asking, it's a rhetorical question. I'm asking everyone. If this has happened to a white community, racism, the whole world will be talking about today about paying reparation for what happened. How do we reestablish these people? But the Black community has been forgotten to deal with it on their own. And despite its intergenerational trauma, a lot of people haven't gotten closure. Even I talked about medical students asking us to change the history of medicine because the history of medicine they were learning was false. I now started with some other professors on decolonizing the medical school curriculum. They told us all those experiments whereby a woman was tied without anesthesia, the breast was dissected, the womb was dissected in the past, and she was screaming and died on the table, that all those things should form part of the history of medicine, that those things have been hidden for centuries. Following the Black Lives Matter, they can no longer tolerate that. They want the truth to be told so that they can bring about a closure. So on the kind of world stage, there has to be effort to address the ills of the past, especially the ills that were done to the Black community. Slavery is a huge one. Apartheid is a huge one. Thank you.
Yeah, I think there are lots of comments here about the fact that, yes, we recognize that racism itself is a psychological trauma. I don't know if anybody here watching watched the BBC drama called Sitting in Limbo. And I felt, so for many of these things, you know, you see people getting beat up and you think, well, yeah, that's a bit extreme. But I found that one really chilling because it was somebody that you and me and lots of people here will know, who had been here for 50 years, sitting in his house, but yet can be taken off to the police station, detained, and then the plan was to deport, even though everybody he came into contact with knew that this was wrong. And I suppose when you say about the NHS and the way it treats people, like that nurse you gave an example for, the NHS is a microcosm of our environment. So you can't divorce what happens in the NHS, irrespective of how many courses you're made to do. They actually, they don't change their personality when they come to work. There are comments here about, and which I agree with, that there needs to be truth and reconciliation regarding the transatlantic slave trade. We've seen environments where a Truth and Conciliation Committee has seemed to have worked, like they did in South Africa. And someone's made a comment that Jews can still claim reparations today, even though we don't seem to have had reparations for the Black community. One of the questions people have asked as well, do you have any figures for the number of people or the percentage of people in the Black population that suffers from PTSD compared to the rest of the population? I think you're on mute.
I think there was a slide on that that tried to explore that.
Okay. For those of you watching who want to know a bit more, the slides are available.
I think I highlighted that in one of the slides.
In the chat.
But let me see whether I can get it up.
Thank you, Nadine. Nadine says it was a plan to twin a town in Ghana with Liverpool.
Yeah.
And there was an event in 2017 in Ghana with some church leaders from Liverpool, and they touched on this very issue about reparations and trying to raise awareness within our communities about things that happened in different cities and towns and countries in Africa.
Yeah, I heard about that, but I don't think they had the courage to move on with that. I don't hear about it anymore. I heard about the Ghana Liverpool stuff, but I don't know what the outcome of that is now. Has there been reparations paid? I don't know. So Black people are 20% more likely to report having serious psychological distress than non-Hispanics.
Yeah, I think they remembered this, but what they were asking, because these figures are for the US, are there any UK figures?
No, unfortunately, there isn't specific figures from the UK in that regard. Most of these research most times are done outside the UK, unfortunately. But this particular one is from around 20% of people who experience trauma go on to develop PTSD. I think it was a study in the it was from the National Center for PTSD and PTSD UK.
Okay, but they didn't actually look at this in terms of race.
Yeah, no, they didn't. It's just the general population.
Okay.
Yeah.
Well, thank you for this really interesting session. There's been lots of questions. And I think it has raised the real issues of how many of us feel about reparations and the chronic stress and trauma that some people might be exposed to just because of the colour of our skin. And whilst it's abhorrent to many, it's an accepted fact. And presenting today some of the things that we can look at to try and help people through this, because that's what it is. And I suppose the other concern is that if you have a background level of stress, it means that when you're exposed to additional stress, like what happened during the COVID pandemic, and that's why this is quite topical, it just overlays that on the background of stress and you become even more stressful. So it was really fortuitous that you presented some of the things that you've talked about today, and thank you very much for coming back. So I'm going to hand over to the CAHN team. Please, there is a survey. I'd be really grateful if you can fill it in and let us know how we're doing. That survey also will ask the questions about what sorts of topics you'd like to see. We are planning to do a month on cancer because that's another area that we know is important to people to try and find out more information on. But thank you so much for joining us today. I'm going to hand over to the team, and thank you once again to Dr. Ambrose.
Thank you. Thank you, Dr. Nwachukwu, for a very informative session. It's fantastic on a topic that, you know, not to be taken lightly at all. And thank you to our chair and medical lead, Dr. Ngozi. That's fantastic. Also, thank you to our attendees on Zoom, Facebook and YouTube. Thanks for attending today. And if you would like to access today's Health Hour session, you will be able to find it on our Facebook page, also our YouTube channel, along with any of the other sessions that you've missed. And to receive a copy of the presentation slides for this session, please email your requests to health@cahn.org.uk. We also have some fabulous upcoming events and opportunities that you can attend, which I will share with you very quickly. So do put them into your diary and share them with your family and friends. Everyone is welcome to attend, and it will be great to have you there. So as CAHN, we hold regular weekly sessions, and these sessions are fabulous and will help to keep you healthy. And our first one is our Healthy Arts session, which occurs every Tuesday evening. And this upcoming Tuesday, we're going to be having an exciting discussions on healthy eating and how food relates to stress. So the talk will be facilitated by Dr. Hibi O.C. Kwasi, and will include an engaging 30-minute circuit training session by our physical instructor. And that is on Tuesday, the 26th of April at 6 p.m. to 7:30 p.m. And our guest speaker is a registered dietitian. So the topic will be on traditional cultural remedies versus the westernised healthy eating advice. And you can join us on Facebook or YouTube. You can email events@cahn.org.uk to get Zoom details. Another event is if you would like to learn about housing pathways, please attend our event by the One Manchester Housing Services. Experts will be in attendance, and that is on Tuesday, the 26th of April, 6 till 7:30 p.m. And again, for further information, just email events@cahn.org.uk or call 077 10 022 382, and we'll put the details in the chat for you. Also, the Home Advantage International Services invite you to this month's family seminar event for couples and mature singles. And that event takes place on Saturday, the 30th of April, and it's from 1 till 4 p.m. And it's a face-to-face venue at the World Harvest Christian Centre, which is on Seymour Grove, South Clayton in Manchester. And the postcode is M11 at 4PG. Also, there's our Made by Mortals event that you can attend, which is a workshop called Hidden Stories, and that is live, and that will be on Wednesday the 11th of May, and that's about mental health, and that will be at 1:30 p.m. and that's at RNCH Concert Hall, which is 124 Oxford Road, Manchester, M13 9RD. Also, we have the Sick Festival 2020 too, which hits the streets through the month of May. It is a public festival which is about creativity, and it's happening in Moston, Harpay, Charlestown. So, you know, to register for this and to find out more information, do email our CAHN events team. And we also have the Windrush Day, which is upcoming soon, and that is a very important day for our community because it marks the arrival of our nearly 1,000 members of our community who arrived in the UK from the Caribbean in 1942. So this fabulous event will be taking place in Alexandra Park in Manchester. So do join us on Saturday, the 25th of June, and that's from 12 midday till 4 p.m. Also, if you are worried about mental health, or you know somebody that's close to you, we do have a suicide campaign, you know, because we do recognise that early intervention is vital. So, you know, if you do need any support, do email help@cahn.org.uk, or again call the number 077 100 22382, and we have professional counsellors ready to listen and to advise as well. And our counselling service also offers bereavement support and emotional and wellbeing support as well. So do contact us for help or advice, and you can also text us on that number. The service is available 7 days a week at 9 a.m. till 9 p.m, and it also includes a family and advocacy support services. And do look out for our CAHN crowdfunding campaigns. And just before we go, we'd just like to say a special thank you to our CATHIP partners, who are BHI Leeds, RAFTA, International Development Agency, Croydon, BME Forum, Enfield, Caribbean Association, and RCCG in Sheffield. So these health hour sessions are well attended and have a huge impact on the health and education of our community. So please do continue to attend and spread the word. And we're looking forward to seeing you again next week. And the topic next week will be on learning disabilities, and we will again have a consultant guest speaker. You can sign up to our newsletter as well. We'll put the link in the chat box, and then you will receive information and contact details and links about all of our upcoming events. Also, please provide us some feedback. As Dr. Ngozi mentioned, it is, you know, we'll look forward to receiving your information and to hearing from you. And it can be done via the Zoom poll, or also it can be done on the Facebook page or on our YouTube channel. And I'd just like to finish with a big thank you again from all of us at CAHN to everyone for attending today's session. We appreciate your valuable contribution and your support. And do contact us if you have any queries or need any help. It's help@cahn.org.uk, or again the contact number 077 100 22382. So enjoy the rest of your day. Take care. See you next week. And do remember, we're here for you. Bye-bye. Thank you, everyone.
Welcome to our Caribbean and African Targeted Health Improvement Programme, CATHIP Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.